welcome. Let's start, shall we? So I'll just do a few, if I may. First of all, do some house notices and welcome everybody. So welcome to our Council of Governors meeting for December. I think we're now being recorded, so I hope that on the end of the as well as recording the meeting, we've got some staff and members of the public present to either view or listen in. And if you're a member of the public and you're viewing the meeting, can I ask you to turn off your cameras and just listen to the sound, please? That just helps us maintain the internet strength. And if you can go on to mute as well, that would also be helpful in managing any background noise. And there's certainly an item later on in the agenda when the public can ask questions of the business of the meeting. So we welcome all present. We've got the Chief Executive here. A number of my non-executive colleagues are also online as well to do with their appropriate sections. We're expecting Howard, Michael, Lucy and Terry, and I think I can see all their initials or pictures on my screen. Tom Quinn, who's recently been appointed, had hoped to be here, but he's been otherwise detained by his work commitments with the university, and he's got several other CCAM commitments this week. So he apologises for the meeting, but for very genuine reasons. Also, I could take the opportunity to congratulate Nikki, our lead governor, on the birth of her baby daughter. So congratulations, Nikki.
Thank you.
We'll formally add that to the minutes of the meeting.
Thank you.
So congratulations.
Thank you.
Hope all is well. Are there any other apologies at all?
Yes, so we have apologies from Cara Woods and Sarah Swindle. Vanessa Wood was hoping to join us this morning until 10 o'clock. She's got a meeting. She works for AGK Thanet and she's got a funding meeting which is urgent, so she may not be able to join us for the first part, in fact, but we're hoping she might join. And Howard Pescott is going to be joining us at 12. He also has a work meeting. There's a lot going on for anybody in this sector at the moment, isn't there? And he'll get to us as absolutely soon as he can, and they all sent their sincere apologies.
Okay, thank you, duly noted. Are there any declarations of interest that we need to note for the meeting? Everyone is clear. Okay, thank you for that. Item 4320, the minutes from the previous meeting, action log and matters arising. Can we take the September Council of Governors minutes as read? Are you happy to approve them? Any amendments? It's good. We've got the Izzy quite correctly put on the annual members meeting. And this one we've got to approve the minutes from September's meeting, just while our memories are fresh, certainly those of us of certain years, so it's fresh in our minds. If you can recall September, congratulations. More importantly, if you can recall the meeting and are the meetings minutes a true and accurate record.
David, I think we had Marcia and Graham trying to come in.
I do apologise.
For last meetings.
I missed the hand on the bottom there. I do apologise. Wasn't coming up. Marcia first.
Mine is just very quick. On the September minutes, point 27.5, it says Malcolm asked about the Emergency Operations Centre clinical safety project, and it wasn't Malcolm, it was me. I know we've got the same initials, and I don't mind because Malcolm always asks really clever questions, so I don't mind getting confused with Malcolm.
Well, you take the credit. Did you get the answer you need, though? The important thing is that did you get the right answer?
Thank you.
That's great.
I'll update that. Thanks.
Graham, forgive me, I missed your hand raised. I do apologise. Graham? You're on mute, Graham.
Yeah, sorry, Jim. Thank you very much. I hope it's the right point to raise this. I just feel that the level of initials and jargon has rather increased again in all the papers. I have raised this before, and I think somebody else made a comment to me a few weeks ago, another governor, that it was quite hard. I was reading all through these papers last night, and my knowledge of this is probably average. But anybody with lesser knowledge of me would have been completely confused. And Chair, I just raised this. I'm not asking for anything to be changed in the minutes, please. But just generally in all these papers, I think there's 75 pages, I think it is. They are very long, and I would just ask that we could try to, for the benefit of the public at large, the NHS has its own language. I have to accept that, and every organisation around the world has its own language. I just hope that we might be able to make it slightly clearer in the future. That's all.
Thank you, duly noted, Graham. And I just ask colleagues when they're speaking to papers, if they come across any initials or acronyms, can you please translate for the listener, please, to make absolutely certain that we're all receiving the same message. Thank you. That's duly noted. So we've done declarations of interest. We're on to the minutes. Anything else on minutes? We've got the annual members meeting. For those who are present, are you happy to approve the minutes of the annual members meeting in September, which I think we got positive feedback about? It was our first virtual annual members meeting, but I think it was overall, I hope colleagues feel it was a useful meeting and contributed to public knowledge, public awareness of our service. Okay, so I can take silence as assent. Minutes duly approved, so they'll be put into the record and then we'll take them forward. In terms of the action log, is there anything we need to bring to?
Sure, there's only 3 that are open, and happy to take questions on any of the closed ones. So number 288 was an action for Al Reimer as chair of the Appointments and Remuneration Committee to look into the 12% remuneration increase for directors that was reported in our most recent annual report. And Al has provided an update for us. He says the finance team have reviewed this, and the increase in director remuneration was, as suggested at the COG, the result of a number of factors, including an annual very senior manager pay increase, which had been recommended by the Department of Health and Social Care for the whole of the public sector, the additional cost of an interim agency HR director, and while Fiona was acting CEO, a responsibility payment to the Deputy Medical Director for acting up as Medical Director. So the 12% increase was a combination of those factors. So I hope people are content with that, and we can mark that one as closed.
Yes, and can I say, for the sake of organisational morale, our directors get very modest pay increases. There's some artefacts there of why that proportion appears so high. The directors get paid in appropriate rate of inflation, like every other members of the NHS staff, and nothing else. So yeah. Just so that can be noted.
Cool. And then the other one, which is one of the other ones open, was for Michael and yourself, David, around looking into the issues around CFRs accessing funds. So I don't know if either you or Michael want to give an update.
Yeah, we've got 2 meetings in the diary with the CFR leadership, one of which is this evening, and Michael and I will be, and a number of other colleagues will just be saying thank you to our CFRs as first of our new annual meetings with them, but also to deal with some other procedural matters which are normal routine business.
Fantastic. And so you'll cover, you'll hear anything about the funding issues there?
Yes. Yeah.
Cool. And then the last one was for you, Philip, which was to think about the PP role, the paramedic practitioner role, and available budget, and report back to David and the Workforce and Wellbeing Committee if there were any issues around funding for the PPs.
You're on mute, Philip.
And we've done that through the Workforce and Wellbeing. So there is a gradual increase in PPs planned. There's a course being trained, but it's not to the level. It's not. We don't get to the level quickly that was in the review, but it is. It's affordable and sustainable for what we're doing at the moment.
Okay, thank you.
Comments or questions on anything else in the action log?
Okay, are you all content with the action? Action has been planned.
Super.
Okay, thank you very much indeed.
Oh, Harvey's got his hand up.
Sorry, Harvey, missed you there.
That's all right. Just on the point that Al Reimer reported on the reason I raised it at the original meeting was that if you were a member of the public, you just see the 12%. There was no
Absolutely.
explanation.
Yeah.
What it's very good to get the explanation, and a lot of it was what we thought it probably was, but that's because we know. It would be very useful in the report next time if there is anything which seems larger than expected, that there's an explanation there, and then we don't get any questions and everybody knows where they are. So we have an assurance that that will happen.
Yeah, I think we can put a note in and make sure it's more it is explained. But just to assure you, Al, as chair of our membership, are very assiduous in making sure that we have appropriate public sector probity, and the pay of our staff is in line with appropriate guidelines.
Yeah, I don't have.
I know you don't, but I think it's important.
So
I welcome the opportunity to make the point from your question, Harvey. It's very important to reassure our staff, never mind the public, that we do everything by the book. Okay, any other questions? All right, thank you. Now we move on to the Chief Executive's report. And I wasn't at the last Governor Development Committee when this report was discussed. And I know you've asked Philly to focus particularly on some of the operational performance issues in the trust, which I think he would do as a matter of course, and they're certainly relevant at the moment because of the various other challenges we have. So Philip is going to do a presentation, talk through his report to you, and then after that we'll then open it up to questions. So Philip, do you want to lead us into your report?
Thank you very much, Chairman, and I won't be going through the report bit by bit. I'll concentrate on the bits that the Governor's asked me to talk about. So firstly, I'm going to start with COVID. Everything that we're doing is in the light of COVID. So just a quick update on what's happening to the disease firstly, because we are all reading different versions of the press and listening to different versions of what's going on. And if you listen to the BBC, as I do, you'd think that the rate of infection was dropping like a stone, and then it's going to rise again over Christmas, etc., etc. Locally, it's a bit more nuanced than that, obviously. So we have, when we last spoke, and right up until a month ago, I was happily reporting that our patch was in the least infected area of the country, and actually the bits around London were the bits that were worrying me, and then suddenly all of that has changed over the last 4 or 5 weeks, and we've seen rates of infection in some areas, particularly in Kent, go up very highly. When I talk about rates of infection, I'm talking about the rates of infection in the over 60s, which is the age group that we are most worried about. Normally, the good news is that overall, the rates of infection in the southeast and in our patch are coming down as a result of the lockdown. The bad news is that what happened before the lockdown has led to these increases that I've talked about, and we now have Swale, Gravesham, Thanet, Medway as 4 of the top 5 local authorities for infections of over 60s. So the pressure on hospital beds, despite the fact the infection rate is dropping, the pressure on hospital beds isn't yet dropping. So that is still going up and getting close to, in Kent, it's now above the level of the peak of wave 1. But there are more people occupying beds now because of COVID than there were at the peak of phase 1, wave 1. But that's in Kent. Surrey and Sussex are slightly less badly affected, and their rates have stabilised. So the occupation of the beds follows the occupation of or lags behind the infection rate. So we can expect to see those rates of hospital and occupation to be high for a little while before that starts dropping. And it's causing real pressure in the Kent system. I'll talk a bit more about that as we go. But so, for example, Kent, the Medway Hospital Foundation Trust, 450 members of staff off sick with COVID. You can imagine what effect that has on your ability to increase your wards, which we're trying to do at the moment to cope with the additional pressure. So what effect is that having on us and our staff? Well, in general, the effect of COVID on us is still on the increase. So it hasn't come down. It's slowed a bit with the lockdown, but it hasn't come down at all. And we're at about 200 staff who are away from work because of COVID. So that's a mixture of people who are self-isolating because they or a member of the family are going in for surgery or have to self-isolate because of other members of the family. That people who've got COVID symptoms, we've got 57 now, which is about as high as it's been in the trust. 57 members of our trust with confirmed COVID, and we've got another 50 who are clinically so vulnerable. They're classified as the clinically extremely vulnerable group, that during lockdown they have been told not to report for work unless they can work from home. So that 200 staff is a big chunk for us to be losing just as we're coming into winter. So we're working with everything we can. We've got our own test and trace cell. So what happens as someone goes into self-isolation because, for example, they've been close to someone who has been infected in the test and trace cell, we're able to investigate those people ourselves, get them retested, but do some work with them about whether, if they were wearing PPE at the time, then that's okay. And we go through that entire process and manage to get that we're managing to keep the level of self-isolation in check to a degree, and that's really important. The other things that we're doing is that all our staff now are doing lateral flow testing, which is the testing that David was talking about at the beginning. So this is stuff that you do at home. You do it before. If you're a frontline health worker, we're suggesting that you do it at least 10 hours before you come on duty, even though you get the response within an hour. If you do get a negative response, we think that's good, and you haven't got it, so you then go to work. If you get a positive response, you phone the test and trace cell, and we get you a PCR confirmation test before you go to work. If the PCR test is negative, then you go to work. If the PCR test is positive, you don't. So that's how that testing is working. Obviously, that increases the number of people that we have off, but it stops us having outbreaks. So it's difficult on the day, as you see, your numbers of staff going off testing, but it's much better that than leaving them in the workforce to infect the rest of the workforce. In terms of outbreaks, I talked at the beginning about outbreaks. An outbreak is officially two people who are connected in one place of work who are positive because of coronavirus. So the numbers don't have to be big for it to be called an outbreak, but we have got three outbreaks that we have declared over the last week, and again they're all in Kent. One's at Medway, one's at Paddock Wood, and one's at the 111 centre in Ashford. So the numbers aren't huge. We're talking the biggest is 10, but it is an outbreak. We've declared it, and so we have changed the rules for the people in those centres. They're now getting PCR testing as they report for work, and that was the testing that our CFRs have swung into action. And created a logistics chain to get those tests to the hospital on the day of testing, and a response the next morning. So what that's doing is that's telling us how the outbreak is managed or is spreading or not. So we'll continue to do that for another couple of days before we think we've tested the majority and work from there. So those outbreaks continue for as long as we're getting new people who are connected to the outbreak, and we've had to do things such as stop students going out in Kent. We have stopped people doing overtime in someone else's station. We have stopped as almost all movement that isn't connected to dealing with a patient. So all of that sort of thing are the actions that we're taking, as well as additional cleaning, obviously more adherence to the other rules, and we're working closely with PHE in that space. In terms of what's the final solution, we're all reading about vaccinations, and there are 2 vaccinations. One that is just about ready to come out, which is Courageous, which is the American, the Pfizer one. That has to be stored at minus 70 degrees in a massive fridge, and you can't move it more than 5 times. By the time it gets to the fridge in our area, that's its 5th move, so we're not allowed to move it again for complex medical reasons. Secondly, when you take it out of the fridge, it comes in boxes of 900 tests, or vaccines, sorry, not tests, and you have to use those 900 within 4 days, or they have to be thrown away. So not really suitable for our situation, where we've got small groups of people being tested in small numbers, being vaccinated in small numbers. Much more suited to a mass vaccination centre. So that's where that will be deployed. The second one is the Oxford vaccine, which hasn't yet is behind the Pfizer vaccine, and that is that they're trying to rush through their all their medical clearances. Looks good. It's able to be self-administered in the same way as we do with the flu vaccine. So you can keep it in a fridge. You don't need the 70-degree freezer, and therefore that will be much more suitable for an organisation like us to vaccinate our own staff. When do we think we'll get it? Everybody keeps giving us dates, and then in the last week, NHSE have stopped giving us dates and saying we will give you 10 days notice of it arriving. The only thing I can say is it won't be before the 10th. But I'm really probably expecting early in the new year for that Oxford vaccine. So that's all the update on COVID. In terms of our 999 performance, which people asked me to talk about, I'm going to spend less time on that, because actually it hasn't changed significantly. When we last met, we were in a really poor place, particularly with Cat 3s and 4s, but also our times are going up and up and up. We have turned that around, and so even though our performance is still variable, we're now more in the middle of the pack of ambulance services. It goes up and down every week, of course, but we're achieving routinely 5 of the 8 timed targets. The ones that we're missing are the Cat 1 mean, so that's the 7-minute target, and we're about 30 seconds off that. And the Cat 3 and Cat 4, which are about an hour off in both cases. So in terms of how have we made that improvement, we've managed to get the hours back on the road that are up, despite the fact that we've got all those staff off with COVID sickness and relatively high seasonal sickness as well. And so we're fighting headwinds in that way, but we've managed to get the hours up, which is great. And we're just using those hours slightly more efficiently. Again, a second headwind caused by all the stuff that I was talking about in COVID is that we are seeing a significant increase in hospital handover delays again. And this is particularly in Medway, where it's been a real problem. And again, it's caused by the fact that they're having such problems freeing up space within their own hospitals. But there are times when that has been really worrying for me as the chief exec and for my medical director, and I know for the chairman, because when he worries, I know about it. So I just want to give you the assurance that it has had masses of attention. So yesterday afternoon, I was with the entire leadership of Kent NHS, summoned to NHS England to explain all the chief execs in the Kent hospitals how we were going to work together to solve the problems that we were seeing in things like handovers, but also making sure that the system was working as efficiently as it can get. So it's got tons of visibility. Everybody's trying to do the right thing, but there are some really strong headwinds. I think that's all I'm going to say about EU transition. About 999 performance, except for the fact that I do want to put on record that our local managers in Medway, particularly, have been under real pressure for about 3 weeks because of this, and they have done a phenomenal job in managing the expectations of their teams, the patients that are in some cases waiting far too long outside hospitals in ambulance, and it's in the many hours now rather than the many minutes that people are waiting, and some of those patients are quite sick. And the local management working with the hospital have managed to keep the wheels on it, and it's improving day by day at the moment. So we got to a peak of my worry about 2 weeks ago. Since then, through system engagement and through lots of everybody doing the right thing, working as a team, we've now got way past that level of worry, but it's still not good, and it doesn't help our performance either. You asked me to talk about EU transition. It's 30 days today, EU transition, and if we're going to get a deal, we'll hear about it in the next few days. Graham might know more than me, but I think all the noises are vaguely positive, but the deal doesn't solve the problem. We're still, even with the deal, there's going to be significant slowness at the border because everybody getting used to a new system, even with the deal. It's not the same as today, so there are new checks no matter what happens. So we do expect there to be significant pressure from the 31st onwards, and we are planning. We're probably ahead of everybody else's planning, and I don't mean everybody else locally. I don't mean Graham and his team. I mean the national team who've been so focused on COVID and other things that they're having to catch up, but they are catching up. We had a meeting with all the other ambulance providers yesterday, and everyone has agreed to see if they can free up some resource, and it'll be we've got a mechanism for getting that support, which surprised me, because if you think about what's been happening in the northwest, for them to put their hands up and say, yes, we'll see if we can queue up a few ambulances and send them down to Kent, is quite a thing, considering the pressure that they've been under. It may not happen, of course, on the day. It'll be a who's in the most trouble decision, and that'll be made by the system in the centre. So our plans are solid, and they are in place, but it's not going to be pretty, even without a deal. Even with a deal. Without a deal, it could potentially get very ugly, not only for us, but for the local systems, the local government, the local hospitals, people getting in trouble to get their staff to work. So all the issues that we've just been talking about will suddenly become magnified. Lastly, I wanted to just focus on some really good news, because there's a lot of good stuff happening around the trust, and we ought to one, acknowledge, and two, celebrate. So since we last met, 111 CAS has gone live, and it went really well, considering we were doing some pretty complex and multifaceted change projects. right in the middle of a pandemic, and our reputation as a trust has been significantly enhanced by the way in which that was handled. Not only that have we done 111 CAS, which has been working since the 1st of October, but we have slowly been doing some of the bits we needed to do for 111 first. So this is the system which will increasingly say, instead of going to a hospital as a walk-in, you phone 111 and book a slot, or get diverted. And last night we connected to the last of the EDs, so I can now say that we are connected and have that ability to book slots into ED for the first time ever in every single one of our EDs. Now that's an amazingly complicated thing to do because it takes a different link to every ED, because no EDs are the same. So we've managed to do that, and we've done that in 6 weeks. That's been an amazing achievement, and to most of the walk-in centres and the other urgent care centres. So that's going on ahead. You'll start seeing some publicity about that quite shortly. They were going to start today, but it's gone a bit quiet, so maybe that's being overrun by government issues. But you'll start seeing that, and that's what that's all about. Then this year's flu uptake has been higher than we've ever seen before, perhaps understandably, with more staff keen to get a flu vaccine early. And we've also just closed the staff survey for the year. And again, we've seen record numbers of staff filling that in. Doesn't mean to say that they're filling it in saying that everything's wonderful. In fact, that would be a waste of a staff survey. But having people filling it in is a good sign, as most of us who've been in management, a good sign about engagement. If you think you'll fill in a survey, if you think you're just going to be ignored, you probably won't. So we won't get the results of that for a while yet, but it's great that people have done it. And then lastly, this week we opened our latest Make Ready Centre in Falmer, just outside Brighton. Yesterday the Lewes station moved into it. Tomorrow the Hove station moves into it. And then over the next 2 days, the current MRC in Brighton will move in, and so that's 3 stations into a big Make Ready Centre at Falmer. I was sort of talking to the boys and girls who are already in just before this meeting, and it's gone really well. There's tons of enthusiasm for the new way in which you're able to work from that, and it's been well done by our teams. Chairman, I'm going to stop at that point and go for questions.
Thank you, Philip. So, colleagues, a comprehensive report there. Headlines of COVID, performance, EU exit, the positive news around 111 and our clinical assessment service, and some other interesting developments. So, question first from Harvey.
Yeah, Philip, one to say I was extremely encouraged by what you've said about the situation in Kent. It's something which is very worrying to anybody looking in, and the latest figures don't show that the infection rates are actually coming down. The thing that I didn't pick up on quite was the extent to which our own staff are being affected by COVID itself. I know you spoke about us having some areas where people had been, an outbreak had occurred, but I just wondered, in terms of Kent, is it significantly more of an impact on our people? And the other thing is, great to hear that some of the other ambulance services can provide assistance, and obviously that's in some ways reciprocating for the assistance we provided to Yorkshire. But what about private providers? Are we well geared? Are they going to be able to assist, or do the restrictions on them impact their ability to help us because of COVID?
Okay, I'll pick those up one at a time. Firstly, so the infection rates amongst our staff, there are 200 staff roughly who are affected, and it is slightly weighed in Kent, but not massively. So the local outbreaks are the difference. We haven't had the local outbreaks in other places to the same degree. So 40% of the 200, so about 70 odd, is Kent, which isn't too far from our workforce mix. But you can imagine that if you are in an ambulance for a long period outside a hospital with a patient who's got COVID, the chances of something slipping in your PPE or something like that, it definitely goes up. So we're really worried about it, but we're doing what we can. So that's the answer on that. Sadly, we do have one member of staff who is in intensive care, and he is in Kent. But my reports from yesterday, which is the latest report I've had, is that he is texting from his intensive care bed, and that's a good sign. And we're still in the same positions we had amongst overall deaths. No members of our permanent team have died. We've lost one bank member of staff throughout the entire system. So, secondly, the second part of the question was about EU transition, and so yes, the others have said that they will free stuff up if they can. That's not the same as I'm not as confident as I was this time last year, because last year we were doing it in spring when they had when they had spare resources. Now they're doing it in the heat of winter, and they're all going to be run ragged. And so it could be that even though they say yes we could, here's the risk, and the risk becomes unacceptable, we don't end up getting it. We have looked at other ways of creating workforce, such as buying leave, things like that, which would make up some of the difference. In terms of private providers, we've got the private providers that we have been able to get, and they are all signed up to work throughout the EU exit. They're working as normal, but there isn't a spare bag of private providers waiting to be tasked. They're all busy.
Okay, thank you.
Thank you, Philip. Jeff, did I see your hand raised a moment ago, or was I mistaken?
Yeah, I did raise it briefly, but I think but Philip covered it anyway. So I was going to ask. That's fine.
Oh, thank you indeed. Are there any other questions of the Chief Executive? So a comprehensive report. Are you content to receive that? Okay, it's clearly it's clearly all of the staff are having a challenging time. I know executives are working hard supporting the frontline crews who are having a particularly challenging time, and we send them our best wishes and thank them for what they do and their professionalism. It's a very difficult time for the country. Okay, thank you for that. So we see Chief Executive report has been received. Now we move on now to item 4520, which is the assurance from non-executive directors regarding the integrated performance report. Now what I want to suggest here is you've got the comprehensive integrated performance report in your pack, and that was presented to the Trust Board last week. What I'd like to propose is that any questions on the detail of the report for my non-executive colleagues, we can hold off until we reach the point on the agenda where we hear their exception reports from their work. So I should think most of the issues will be covered there. But at this point, can I take any questions of clarification on the report? It's a new format. It's the second time we've received it in this way. Are colleagues able to understand the report? you content with the presentation? We'll go through it in detail shortly. Jeff?
Just a very quick one, really. As reading through it, bearing in mind this report is visible to the public, I think, again, this really reiterates Graham's point about the use of acronyms.
Yeah.
But I think one of the ones which I think struck me particularly was the use of the Cat 1, Cat 2, Cat 3, Cat 4, which is mentioned quite widely within the report, but nowhere within the report does it actually explain what those categories stand for. So I think for a member of the public, again, it would be something which they would look at and they say, yeah, but what is that?
Thank you. Thanks, Jeff. Good shout. And we'll make sure there's a glossary on there. There should be, that's a learning point. Thank you. Harvey?
Yeah, just a point which struck me, looking particularly at, if you like, I think it's about page 38, which is the headline of the targets and performance against those. It's just the use of the colour. It just looks or gives a false impression, because we put targets and we put more green in the target column, whereas a lot of those don't actually have a target as far as I'm aware, and we use grey. So if somebody reads this, they'll see some red, they'll see some grey, and they'll see a few bits of green. It would be better, I think, if we had grey in the target column, just so that people aren't confused and it gives a better impression. A lot of this is to make it simple for people to interpret, and we all understand things, but just as Jeff and I think Chris have mentioned about the use of TLAs and things like that, you know, not everybody understands what a RAG report is. It's very simple things, but they matter because people glance at these and then they get a slightly wrong impression.
Okay, thank you, Harvey. Duly noted. We'll pass that back. Thank you. Malcolm, good morning.
Hi there, good morning. Just a couple of quick ones. Firstly, to my view, I cannot see any page numbers, I don't think, on the IPR. At the top, in the index there is, but on the actual pages, I don't think there are any page numbers, which would be useful for navigating through. And secondly, a question for yourself, Chair. I had a question in the IPR regarding operational performance, and I'm just not entirely sure which at what point I should raise that. Does that come under the investment committee?
Yes, it does. Yes, Finance
Okay.
Investment Committee. Yes.
Okay, thank you.
Yeah, thank you. Yeah, happy. That's certainly been an item they've discussed in some detail in recent meetings, so we'll come back to that at the right time. Thank you. Okay, any other questions at all about the format of the IPR? Integrated Performance Reports. IPR, Integrated Performance Reports. Okay, thank you for those. We'll pass those back to the authors, and we will continually improve its presentation. So thank you for that. I think we can now move on to the Membership Development Committee. So Brian, you're going to take us through your reports?
Very briefly, I'll just summarise what is quite a long report, Chair. Membership Development Committee is all about, I should refer to it as MDC in the rest of the report, actually is all about reaching out to our current members and trying to actually engage new members. And of course, in the current situation, that's quite difficult to communicate and engage physically with existing people. However, the membership development staff managed very well to deliver the annual members meeting, which the chair's already actually referred to, and that was online on the 4th of December. A few minor technical hitches, but actually it was with some debate that had gone on within the NBC committee, the staff actually very much rose to the occasion. So we had at a peak 165 live attendees on the day, 35 of whom were external and 130 were staff. So, and we also managed to record the event for catch-up viewers who could actually view it later. And I have to say, I'm not quite sure how many people actually did take the opportunity to do that. In addition now, as we see here, we have live streaming and access to both board and council meetings, and the public members and staff members are welcome to join events and watch live and ask questions at the end. So I think, you know, a lot happening in terms of actually trying to make that communication in difficult times. In fact, numbers at the September meeting peaked at 93, which is, I think, is the most we've ever had. And also staff governors received some pretty good feedback from colleagues who had watched their performance at the chair, at the meeting, and again, a good impression created by you too, Chair. So that's actually, it's good that in difficult times we are actually managing to fly the flag. And I think even hearing what Philip said earlier about how we're dealing with matters, anybody listening must realise the pressure that we're actually under, but take some heart from what's actually going on. At the NBC, we also tried to actually trial a staff and West Sussex Governor online member constituency meeting to try and see how that happened. So they both took place on the 25th of November. I'm afraid in terms of the constituency meeting for members, nobody turned up, and we're looking at how we run the next one in terms of actually both timing and how we advertise it. But in actual fact, we did get a pretty good reaction from the staff governor drop in session, mainly support staff. And there were themes there that I know the staff governors agreed to take forward and will actually come up in terms of this council meeting. More traditional methods of actually communicating are still there in terms of our periodic newsletter, Your Call. The November one went out, and again, I think one of the better communications that we've actually done covers the issues in terms of CAS 111, etc., and also spotlights a paramedic practitioner. So within the MDC, there are a number of other groups and committees that actually report into it. So whilst Shakir and Jeff Kempster are the council representatives on the Inclusion Hub Advisory Group, with an acronym of IHAG, actually, and all governors are welcome to observe that group from time to time. And in general, I would encourage some of our governors, particularly some of our newer governors, to take some time out to actually observe some of those meetings and to contribute. The staff elected governors, so Waz and Malcolm, who I can see online today, are permanent members of the Staff Engagement Advisory Group. And as we've heard, it provides the forum for feedback. And that, again, a lot of effort's gone into that in the last year or so to revitalize it. And it's good to hear again that, as we heard earlier from Philip, that actually staff are actually responding. We know there are issues, but if the communication lines are open, that helps us to address those and support. And in similar vein, on the Patient Experience Group, acronym PEG, in actual fact, we have Nigel Robinson and Harvey Nash, who are newly appointed governors on that group. The first meeting of the Refresh Group took place on the 23rd of November, and I know there's a lot of work actually being laid out to be done there. And actually, having spoken to Harvey and Nigel just before this meeting, we know that a series of other meetings are being set up, and we look forward to seeing that group progressing and catching up perhaps on some stuff which has been delayed in the past. So in general, I would encourage our fellow governors to both participate in MDC meetings. Again, you don't have to book an appointment, just turn up when they happen. Next one is the 2nd of February. And in terms of this report, the formal bit, if you like, is to actually ask governors to note the report, review any of the attached meetings in more detail, and there is a lot of detail, so that contributes, unfortunately, to the 175 pages. We only meet 3 times a year, so that's actually, and this meeting we actually have 2 we would love some additional feedback on the annual members meeting in terms of how you felt about it. And this is again from both members of the public and from governors, because I guess we're going to be doing it in a similar way next year, notwithstanding what may happen in terms of vaccination. So we'd love some, to challenge what we've done this time round, help us to improve it. And again, let's encourage our governors to use the information and actually help us develop the communications with IHAG and CIAG. So that's the sorry, I'm not going to go through the acronyms because I'm short of time now, but also encourage members who are actually online to join our trust. It's for free. In actual fact, you get the newsletter directly along with other communications, and indeed you can influence who the next set of governors are or even become one yourself. So happy at that stage, Chair, to take any questions or comments.
Thank you, Dee. Thank you for your comments about virtual working. I think as we learn from this current emergency, I think going forward, I'm sure many elements of this will remain, but we must get back to meeting in person as well. I can't wait for that opportunity, but I think we've learnt a lot from this mode of virtual communications, and ironically, it's led to more inclusion. So I think we can only let's hope we can build on that going forward. Can I also note from your reports as well, Greg Smith, Voluntary Services Manager for Community Resilience, has started a new role as Operating Unit Manager in Kent, which I was very pleased to see. So congratulations to Greg, and thank you for what he did in supporting voluntary services in the Trust. So first question, Harvey. You're on mute, Harvey.
Right. It's not so much a question, more a comment and a plug. The first West Sussex Governor constituency meeting, which we didn't have anybody attend, was held at a lunchtime. So what we've actually now done is we've arranged to have one in an evening, and that will be at 7:30 on the 10th of December. So if there are any members of the public from West Sussex who would like to contact us then, please do so. Okay,
thank you for that. Any other questions or comments on the Membership Development Committee report? Another comprehensive report, I think. Okay, thank you.
David, it's Philip. Yeah. I just it's difficult to see on here. Brian mentioned two of our staff governors. We've got a complete set of staff governors on today. So Marcia and Christopher, both here as well.
Apologies to them, indeed they are.
Yeah, well spotted. Okay. Thank you. That's one of the downsides of this means of communication, particularly when you've just got initials at the bottom of the screen. So there are some challenges. Okay, we can conclude on that item. Thank you. Move on to item 4720, which is the Governor Development Committee. Now, Nikki was away on maternity leave, so Waz, I think, has been asked to give this report. So Waz.
Yeah, thank you very much.
Calling the South Coast. Come in, Waz.
Can you hear me now?
We can indeed.
Lovely. Thank you, Mr. Chair. It was attended by a fair number of staff, and it was a very lively, energetic meeting. I did enjoy chairing it. We covered the annual members meeting without going into too much detail. It was a very positive reflection on the annual members meeting, in particular of how our staff at all levels came across. The only negative was for some of us it felt too long, and the difficulty in sensing people's thoughts and reactions. So again, looking forward to when we can all get back in the room together. There was a review of the chair's objectives and the welcoming of the new non-executive director, and there was general appraise or a general appreciation of the skills and effectiveness of the non-executive directors on the board. We covered the election proposal, which is going to be brought back to a further meeting for approval. It's holding the Brighton and Hove seat vacant for a little while from 2021 to 2022, and to bring East and West Sussex into alignment by increasing representation to West Sussex. The aim is to have an annual 1/3 rotation of the council So there's always continuity of experience in the Council of Governors, and like I said, back for approval. There was a review of the Governor's attendance at previous meetings, where in our constitution it says if you do not attend 3 meetings in succession, you could be removed. The outcome was that this is going to be reviewed every week, so there's not a lag in catching up with governors who are not attending meetings. And for approval today, there's a governor's query flow chart, which I think Izzy's going to bring up online, but it should have been sent to everyone for approval. It was approved at the GDC, and I think it just needs approval today.
Okay, thank you. Well, should we take that item first then before we get into questions? So, Izzy, may we have the flow chart?
I'll do my best. Can you see it?
Yes, we can. Yes.
Fantastic. So the rationale behind this was that obviously we've got a governor query process that's been in place for some time, whereby in between meetings governors can email myself or Katie with any questions or concerns that you've got, and we will send them to the appropriate people, making sure that the non-executives see the response with their assurance remit, so they can follow up on anything they need to. I think during COVID, because everybody was so busy, there were a few examples where we were struggling to get timely responses. And so we felt it would be useful to have a kind of escalation route where responses weren't forthcoming. And then also considering what type of query it was that was coming to us and which route it should go down. Was it something that required a management response? Was it something that was purely an assurance question and could go straight to NEDS? Or was it something that raised a serious concern that really needed to be escalated immediately? So this is an attempt to kind of formalise and set out that process. It suggests a 2-week kind of escalation period if a response hasn't been received. And while it looks complicated, possibly, this was about as tidy as we can make it. It's actually reasonably straightforward. So you don't need to do anything different as governors, but you can have an expectation that we will respond within. You should see a response within 2 weeks, and if you don't, that it'll be escalated to the chair.
Who will demand a response?
And this has been discussed in detail at the Governor Development Committee and recommended for approval here.
Thank you, Izzy. Colleagues, are you happy to accept this? Approve, rather?
Yep.
Accept and approve. Okay.
Yeah.
Thank you.
Terry's got his hand up.
Morning, Terry.
Good morning. Morning, colleagues. I'm finding the minutes a little confusing. 1516. It's around the comms strategy. There's a we in there, and I'm not quite sure who that we relates to. So I think it relates to the trust not having a communication strategy, but it could equally as well relate to the Membership Development Committee not having a communication strategy. So I'm just wondering if that could be clarified.
Terry, there isn't a 1516 in this minute. It goes up to 15.2.
So what am I looking at then?
The minutes of which meeting, Terry? The GDC, the most recent Governor Development Committee.
I'm sorry, I'm on the Membership Development Committee.
Yes, yeah, but I can recall. I think I can recall that meeting and that comment. I think it was referring to the trust.
Yeah.
Okay.
Yeah.
That's just for clarification. It was that the action was for me to pass that back to the Chief Executive. Yeah. Okay. Right. In terms of the flow chart, we're happy to accept.
Yep.
Okay.
Yeah.
Thank you. Waz, anything else you want to raise?
No, not for me.
Okay, thank you. We move on now to the Governor Activity and Queries report. I think, Nikki, you're going to take this?
Yep, I will do. Thank you, Chair. In September, we held in-house governor training sessions, which our new governors attended, and 2 of our governors attended a governor focus conference. I just want to touch on what Brian said in the Membership and Development Committee. We have held online constituency meetings in the Lower West and a staff governor online meeting with staff. Our inquiries and information requests, I'm not going to go through them all, it's quite comprehensive and you have the report, but just to highlight that we have received and answered quite a few questions. The highlighted issues for us were clinical education, PPE, and there was one question about environmental factors with new builds. Again, as I say, all that you can read in the report. I do look forward to receiving the future activity reports from the governors going forward. I know this year has been a little bit sketchy. We haven't been able to get out and about as much as we would like to because of the health crisis that we're facing. So hopefully in 2021 we can get out and see our constituents a bit more, and I'll be able to report a few more things that we're doing and activities that we're doing in the next meeting. Thank you.
Thank you, Nikki. Any questions of Nikki? See one. Malcolm, is that I've got the initial right?
No, it's me, sorry.
So I do apologise.
That is fine. Just a quick question, because on our last pack, we had governance questions from April 2019 till March. And this one, the question started in June 20. So I was wondering if we could get the questions that we asked from March to June that not here.
Izzy, can you take that?
Yeah, sure. I believe that we had put everything in that hadn't already come to you as part of the annual report, but if that hasn't been picked up, we'll include anything we missed for next time's. Apologies.
Oh, thank you.
Okay, can we move on then to the next item? Izzy, can you remind me what time were we scheduling a break for, by the way? Comfort break.
Let me have a look. After the escalation report, so it was going to be 11:45. So you could take it now if people preferred, and then come back together. Because, yeah.
Would colleagues like a comfort break now? Or are you happy to press on to 11:45? Okay, should we press on? Then we can have a comfort break in due course. Let's deal with the board assurance committees now. Item 4920. And this is a sort of important part of the agenda when you hear from my non-executive colleagues who are present here today about the work of their committees, and you're able to ask them about their assurance in relation to key issues. And the first one we got is the Workforce and Wellbeing Committee report, a WWC, referred to in some parts of the paper. And Terry, I think you're going to just take us through the headlines.
Yeah, happy to, Chair. I'll assume colleagues have read the report, but I think the important thing is the first meeting was actually observed by governors. So the governors who were observing that meeting might like to feed back to their colleagues.
Thank you. Is there anything particularly you wanted to highlight in the report, Terry, or are we taking it as read?
Oh, we'll take it as read.
Yeah.
But it's the usual themes that governors are used to, and that is about the need for HR systems within the organisation to be both better or automated, for want of a better phrase, and to provide consistent information so that staff know precisely where they are with regards to their pay and other circumstances. So that is a continuing requirement on the trust to get that resolved.
Thank you. Right, so, colleagues, questions and comments on the Workforce and Wellbeing Committee report. Malcolm, then Marcia.
Thank you very much. I have a question that's come out of the previous discussions regarding clinical education, but the question is more about staff engagement. And that is at the last meeting I inquired about whether there had been any engagement or triangulation from the NEDs with those in clinical education to assure themselves that what they're hearing from the executive colleagues is accurate or not, as the case may or may not be. And I received what I think is a mixed response from NED colleagues about whether or not this type of engagement with staff is within the scope or remit of the non-executives or not. So what I'm hoping is that it could be confirmed that this sort of engagement, talking to people sort of on the front line and other colleagues, is indeed part of the NED scope of practice, as I understand it to be. And also if there's any updates on getting that kind of back online with regards to I think there were previously kind of leadership visits to get that that engagement from staff, and to make sure that what they're hearing from executive colleagues is being backed up by staff colleagues.
Yeah, thanks, Malcolm. Terry, do you want to give an initial response on that?
Yeah, so clinical education was the second WWC meeting that since we've met last, and you'll note that the second paper is entirely about clinical education. I have personally been in contact with a number of staff within clinical education, Malcolm, to reassure you. We discussed as a group of non-execs, it feels like forever ago, but I think it was only last week, the need to find a mechanism for reconstituting our programme of visits. But you'll understand at the moment, that should not be a priority for the trust, because we don't want non-execs turning up and not only distracting staff from their other duties, but we need to maintain COVID security to the best of our ability. So I have been in contact with a number of staff in clinical education. I'm not sure you asked this question, but I'll answer a different one for you. Do we feel we've still got the communication systems right in terms of the information we get from clinical education, so that we can be assured? You'll see that in the first report, we were not assured by the changes in clinical education. And when we had a focus on clinical education, we came out with partial assurance. So I think that answers your question quite directly. Are we confident that we're getting the best possible information from clinical education? Well, getting caught out is something that should never happen to a board committee. And so we think there is probably more work to be done to ensure that there is regular, for example, quality assurance of the work going on in clinical education, so that the board can be fully assured that the improvements we would want to see and the improvements that are so important for the performance of the trust are secured going forward.
Okay, and I can just deal with the second part of your question, Malcolm, around the remit of non-executives. Yes, of course, it is for us to triangulate information by speaking to staff. I think, as Terry indicated, we are somewhat constrained by the current way of working. We have made some visits, for instance, the new Brighton developments, which was easier to arrange even with social distancing, because it was effectively the building was being handed over. I've recently been to the 111 headquarters in Brighton and met in Ashford and met staff there. But there are some genuine difficulties regarding control of infection, and we are investigating some way of virtual meetings with staff, if that's at all possible, and maybe we can seek your help there in just encouraging staff to join in if we can get them set up. So it's a real irritation at the moment to us all, and therefore we are relying on other means of feedback and encouraging staff to speak to us. And again, within rules, I've been in the headquarters regularly, at least one day a week, even though we as part of my remit as chair. So it is a challenge, that Malcolm, but we are trying to work on ways of opening up. Some staff still manage to find us though, and if there are issues, genuine concern that the management arrangements have failed to deal with, there are ways of contacting us, and we'll always respond. But I want to be sure the management have attempted to deal with issues first. Yeah. If they don't deal with them, you've every right to raise with them, and I will make sure myself and non-executive colleagues will be on the case, because we need openness. We need absolute openness at the moment, and I think we've got that in the main, but we still nevertheless we need to keep working at it.
Okay. And Malcolm, if I might just to reassure you further, I don't think that the board, I don't think information was withheld from the board. I think that the organisation simply was unclear as to what good looked like, and so actually it wasn't that we weren't getting the appropriate information. I think it was staff within the apprenticeship part of clinical education were still learning what good looked like. So that's the bigger issue for the trust, where we take on new programs, where we take on new work. We have to be very clear what our standing practice looks like. And you'll know as a clinician that you will do that for clinical matters. The interesting question for us to reflect on is why we were not doing that in terms of education, training and development.
I think.
Okay, thank you both very much.
Thank you, Terry. And I think Casey's made a good point that non-executives would be welcome to observe the staff engagement advisory group, for instance. So there's a number of ways in which we can improve things, and we'll look into that over the next few days. So thanks for that, Malcolm. Good prompt. Marcia.
Hi, thank you. Our last council meeting, I asked a question about working from home and support staff that was working from home, and how there didn't seem to be any clear strategy or plan or engagement with staff about this. This was also picked up in our constituency meeting last week, where staff reported feeling forgotten by the trust, feeling hopeless even. Laurie mentioned in our last council meeting that you would seek assurance regarding this plan, but that I didn't see anything on the report. So I was just wondering if there is an update for us today, or if this is something that is going to be picked up in the future. Also, there was mention of potential financial help for support staff, but again, there's no clear communication. So I think the lack of engagement with support staff is quite deafening at the moment, and is starting to create division, I would say. So yeah, that's my question.
That's an important point, Marcia. I'm glad you raised that. I think the remote working has its advantages, but it also has its disadvantages. I made a point actually at the last trust board meeting asking for understanding, because I think there's a huge danger, as with such a workforce scattered across the southeast of England, that messages can be misunderstood. There's only so much you can do without meeting in person. So I absolutely take that point. I know that certainly as a board we are concerned about that. I mean, Terry, you might not have any up-to-date, because I don't think Laurie's online this morning at all. But Philip, can we just maybe, I think it's sufficiently important to just ask you to comment on this, even though there's normally the non-executives that reply to many of these questions. I think because this is such an important matter around engagement with our staff. I know we have done some work with Wellbeing, and some staff have been moved into headquarters, for instance. Is there anything we can just help Marcy with, and what can we do about it going forward? You're on mute, Philip.
So we've done a couple of surveys across all staff who are working away from home, asking about who needs what difficulties people are having, and I think we managed to address most of those. My directors of corporate services report that they are having more contact with the lower grade staff than they used to have. So that surprises me that I'm getting people who
I think some people are feeling that there's no end in sight, and they're feeling quite hopeless. And obviously I understand that you can't give reassurance about how the future will look like for this staff, because at the moment we don't know. But I think they just want to know that people are thinking about them, and they are actually thinking about this. And this is there's actually a strategy, or there's someone out there that is actually considering how the future will look like for these people, because this creates rumours as well. There's people saying we'll never go back to HQ. And it's just, I think it just creates such an unease, and I think it would probably be solved if you at least engage a bit more with staff, we communicate, and at least say to staff, we are thinking about this. But at the moment, they feel that they've been forgotten, and I think that is one of the main problems.
Yeah, Marcia, I think that you raised an important point there, and I think there's two things. One, I will alert the chairman of the Workforce and Wellbeing Committee regarding in order to seek assurance. But through this, ask Philip if we could remind director colleagues and others. For I think there needs to be what's missing is the walk around in person. That, we need to do some virtual walkarounds and just check out how people are. And I can understand. Generally, I'm concerned about misinformation here, and that people get the wrong end of misunderstanding things in all ways. So we do need to do some extra work on that.
Can I just ask, sure. Marcy, the last time we did a webinar on this, there was quite good engagement. Is that too far away?
Actually, support staff did mention the webinar during the constituency meeting, and it was quite far away. And then I think, there was a lot of information given to staff, and that was it. really. There is no, I think they feel that there's nothing being done about this, and they will just send home, and that was it, and that's it now for them. And I think that I just think they need to know that there's people out there thinking about this. It goes the same way, you know, about the financial help that is being mentioned. But really, are people thinking about this? Is this something that's going to happen? Or if it's not going to happen, that's absolutely fine. But just say, I think the trust does wonderful things. I've observed the WWC meeting, and I was, you know, I could see the commitment in people in doing the right thing for staff and patients, but somehow that doesn't cascade down. Yeah. And I think that is one of the problems.
Marcia, thank you. Julie noted.
Dave, may I just come back on that? Marcia, it's not my committee anymore, but what I've done is I've made a note of precisely what you've said and suggested to Laurie that we might have it as an item on the next WWC, so we can actually seek some evidence around it and ensure that staff are properly, well, staff feel, because they may well be properly supported at home, but I think there is a separate issue about how they feel in terms of the support at home. So I've suggested to Laurie that he might want to include that on a future WWC agenda.
Yeah. But it's a timely reminder. Philip has responded, and I'm sure he will take up these matters as well to ensure that we are communicating with staff, because I think impressions can build up in these times, and I think the sooner we're over this, the better. So I think I'm glad you've raised that, Marcy. It's very important. Right. Any other questions from members of the committee? Malcolm.
Yes, thank you. I'm more than happy to come in, but I do see there are a few other people with hands up who haven't.
I just can't. I saw your name and I can't say. I noticed 4 others with hands up, so I'll get to them in a moment. So you go first. Yeah.
Thank you. This is a question that's come out of our recent staff engagement, staff government engagement event, at which it was shared that just as our frontline colleagues are facing ever increased pressures and workloads, so too are our management and support staff colleagues also under a lot of pressure, increasing workloads, and that often it is felt that the teams and projects are under-resourced and understaffed in order to really properly fulfill their goals and objectives. And that this also leads to a lack of critical thought and review and trialing of projects and ideas before they're kind of being rolled out. So my question is to the WWC as to whether you are assured that these teams do indeed have sufficient staff and sufficient resources to effectively carry out the full range of their duties.
Well, if I may, David, Malcolm, forgive me, that is something of a broad brush question. I think what we would say is if we look at the major projects that have been run through the organisation in the last few months, such as 111, I think we would say that they have been adequately resourced, because you have to judge them by the outcomes. If there are specific issues or specific examples, please let us know, because those sort of broad brush questions about all programmes, all projects, I have to say, my impression is that where the trust undertakes this sort of work now, because of the project management office that has been established over the last few years, by and large, these major change management programs are extraordinarily well run. So if there are specific issues, I think it'd be really helpful to know what they are. So no, I can't give you assurance that I'm content that all of them, everything that we do is adequately resourced, because I don't genuinely know everything we do. There'll be some very small projects that colleagues will talk to you about, as well as the large, as I said, 111 type projects, or for example, the opening of Brighton. So if there are specific issues, by all means refer either through the management system or back to us as non-execs. We would want to know if people think there's a risk of failure of any project or programme in the organisation. But I have to say, my impression as a non-exec, and you know, I am a non-exec, not an executive, is certainly the ones that we have line of sight on. If you judge them by the outcomes, they appear to be adequately resourced.
I think that, Malcolm, if you're referring to normal business items, we need to be aware of that. So I think Terry made a good point there. I think we run the projects very tightly, I think there's more of a challenge with maybe you're referring to some just people under pressure, as Marcia was referring to, for instance. So we do need to understand where that is, but we can make sure the management is taking appropriate action or not. Okay, thank you. Marianne, I think so your hand was raised.
Yes, thank you. My question relates to clinical education, and in fact Malcolm's question has largely covered that. But I just wanted to ask, because we know that this issue has been going on for quite some time now, and we've sought assurances over time, but it seems to limp along a little bit. And one of the key things which I picked up on from the latest report, which obviously did find partial assurance, is that we're not assured that we have a clear strategy. Has there been a sort of formal request to receive this? And will this give us the impetus to sort of really drive this forward now?
There have been discussions with exec colleagues and with the chief exec about what we need to do to move forward. The Ofsted report, and again, governors may be aware that Ofsted came back and re-inspected the provision. They found that the provision was of sufficient quality for us to continue delivering the apprenticeship programme. Whilst that's improvement, of course, that's the least they could find that would allow us to continue developing the apprenticeship programme. I think both non-execs and exec colleagues would agree there is much more to do in clinical education before we can be assured that it is delivering the sort of education, training and development that we require as an organisation. And part of that, as I said in answer to the earlier question, is being absolutely clear what good looks like. If you look at how many students we have running everything from relatively low level, sort of level 2, 3 type programmes right the way through to the very complex postgraduate clinical education programmes of courses, we are a college. We just happen to run ambulances as a byproduct of being a learning organisation. And so we have to reflect that in how we manage the education, training and development. And I think historically we probably haven't. And I think that's a clear focus for Philip and his exec colleagues in the coming months. And it would also be fair to say that as a member of WWC, I feel very confident that Philip and his executive colleagues understand what requires doing in terms of our overall management and strategic direction of education, training and development. Are we there yet, Marianne? No, we're not.
No, appreciate that. Well, thank you for that sort of, for want of a better word, progress report, Terry.
I can also assure you, at our board meeting in the private section of the agenda last week, we also initiated work regarding our education and training, education and development strategy, and I've set a timetable with the executives to come back and discuss it in more depth. So it's something which, as a board, we have come together and realised we have got work to do, and as non-executives, we're giving every encouragement to the executive to formulate some ideas and proposals to come back to the main board for further discussion. So that is on hand to keep you informed of that progress of those discussions.
Appreciate that.
It certainly is. Things are beginning to move, but it's a big challenge ahead. But we will make sure we meet it. Okay, it's very important to us. Very important issue indeed. Any other questions from members of the committee?
Yeah, sorry, I just have a quick question, if I may. Yeah.
Marcia?
Just about managers training. Managers training is seen as a key element to improve employee relationship, and often we hear our managers saying like how they struggle to have difficult conversations with their staff. I'm just wondering, considering that it's such a key element, what is stopping the trust to put this in place and put managers training in place, or support their managers?
Leadership development is crucial. Terry, do you want to give a quick highlight?
Yeah, without trivialising it, Marcia, of course it's COVID. So if you go back a year, there were clear plans on the stocks before Ali Mohammed joined us to roll out a management learning and development programme. I believe resources were set aside for 5 days for all managers in the organisation to be extracted from their normal duties so that they could undertake this training programme. So events, as the phrase goes, events, my dear boy, have overtaken that somewhat, but that programme remains in place and is ready to go once I think the organisation feels that we have the space to deliver it. So it's been recognised that, like many organisations, we promote people on the basis of one set of skills, and then they get themselves in a job and they find that the skills they require for that job were skills they've never developed in their working career. And amazingly, as an organisation, we'd never really taken that on board. I think we have now taken that on board. That programme is ready to go and will be developed as soon as I think we feel we have the space to undertake it.
But I think, if I may, Marcy, you can be sure that the Workforce and Wellbeing Committee, together with Ali, have refreshed the proposals for leadership development. And this is something which, as a non-executive community, and I know is shared by Philip and his executive colleagues, we do need to lay down some, set some standards of what we expect of our leaders and what our leaders can expect in terms of support from the organisation, both the developers, individuals, but also with their leadership skills. And yes, it's about programmes, but there's also about how they are led as well from the top, and the tone that we as a board set. So it's something which I'm certainly making commitment. It's a key organisational priority for CCAM and for the board to ensure that we have leaders with the right behaviours. I mean, there's various skills one can acquire, but I think what Terry's implying as well, it starts with the behaviours set, and do they live them? Do they demonstrate the trust values? And that's something which is very important to me personally, but to the whole board. And anyone who wants to be a leader in CCAM into the future will need to lead within the values of the trust. If not, we don't want them to lead in that way. We don't want them as leaders. So we are going to set the bar pretty high, and it's about what we expect of our leaders to they're going to inspire and direct our workforce, and the tone will be set from the top.
Thank you.
Thank you. Right, anything else on workforce? Can we,
David, if I may, the governors observed the meeting in September, and I'm just wondering if Marcia, Jeff, or Harvey have any additional feedback for their fellow governors.
Thank you for the prompt, Terry.
I don't. I think our report was quite clear. I was, as I said before, I was very reassured about the commitment shown during the meeting. I just think it's a shame that that commitment sort of doesn't cascade down, and that's my only thing really. But I felt really assured that there are people out there that really want the best for staff and patients.
Yeah, I think what I made, Marcia, we have commitment at every level in CCAM.
Yeah,
breathtaking, the commitments. What we're not so good at is joining all of it up. So that goes back to your original point about misunderstandings in the organisation, about communications, well-intentioned communications, which are then misconstrued because there's that lack of join up. And that leadership development is key to joining up the organisation. And we must support our leaders in what is a tough task. And we've got to make sure they're supported to do that going forward. So I thank you for raising. Other points on wellbeing before we move on?
Can I?
Howard? Harvey? Yes, Harvey, yeah.
Only to reiterate what Marcia said, I observed the meeting as well, and it's all in our report. But just to reinforce the need for communications, I've worked in sort of personnel within major organisations going through change, and sometimes probably not as considerable change and shock as we're facing at the moment. But you cannot over communicate. If you think something might be a good idea to put it out, then it certainly is a good idea to put it out. So anything that Terry or Laurie can do to encourage that, the better.
Yeah, thank you. I think we also, if I may,
thanks, Harvey.
Be clear in the organisation what is leadership communication, what we expect our leaders to communicate, and what is then supported by the communications department. And sometimes we confuse the two, and it goes back to leadership behaviour in the first instance to make sure they communicate with their staff and don't leave it to the communications department to do that for them. And that's what we've got to get right, absolutely right in CCAM, because everything gets blamed on why has the communication department not done something? Well, they're only as good as what they're informed sometimes by leadership, and we've got to get it right. Okay, let's move on, if we may, from workforce. Thank you for that. That was a really good feedback. So thank you for that. Can we move on now to Lucy and take the Quality and Patient Safety Committee report?
There were a few points I wanted to just draw out. The first one was the EOC clinical safety discussion that we had. We looked at a number of areas, but I think it's important to know that we did look at the surge management plan, and we were assured that we have the plan in place for when we get very busy, and it was extremely well explained. And we were assured that when we are busy, we know what actions we're going to enact when we're unable to meet demand, and I think that's very important. And the other area I draw out of that was that on the EOC welfare call compliance, that also we are now complying with the standard that we have set. There is an updated policy which we've asked to be reviewed in the committee, but we are doing a lot better than that than we have done historically. And we are also up to date on our audits as well. And Fiona in their board said, I think it's the first time in a very long time that we're now compliant with pathways, which is exceptional news. It's taken a lot of time for us to get there, because it's not only about using pathways, but it's about having the audits of the use of pathways, which is where the call operators get the feedback on the calls, and that's so important for learning. So that was really good to see. We had a good overview of the launch of 111 CAS. We were particularly interested in patient safety, so had we seen any rising complaints and incidents and SIs, and we were assured around that. And the last one I wanted to put out was just around heart. Normally there's an annual national audit of heart in September time, but because of COVID that hasn't happened, but we did get a full review of the heart team, and again we were assured on where they are. And going into this period, I think it's fair to say from an EOC perspective, we've never been so well staffed from a clinician point of view. That does lead to some questions, and we are planning to have a extraordinary QPS FIC meeting in December, specifically to look at patient safety and performance going into the winter period, and a number of scenarios that we may need to face to make sure that we've got all the appropriate processes and governance in place as we come into this period, because with Brexit and COVID and just the general winter season, there are a number of things that could hit us. But it was a very good meeting, and it was attended by a number of our governors who have written up a very kind report. So thank you for that. We overran slightly, which I hate doing, but it was necessary. There was a lot in there. But that's my report, David, if anyone's got any questions.
Thank you. HARS stands for Hazardous Area Response Team, for those that are unaware of that title. And I think as well, Lucy, I think it's fair to say that COVID processes, policies, procedures have, just going back to the performance report, have dominated discussion to make sure that our staff are getting the, we're doing all we can to make sure our staff are working in a safe environment.
That's right. But we've been very specific on QPS that it is important that we continue with the meetings that we had scheduled, as well as having extraordinary meetings to talk about COVID, because otherwise there's a danger that all you do is talk about COVID and you don't actually get to make sure that and put the governance over everything else that's happening in the trust. So that's why we've had extraordinary meetings. I mean, if I flip us back into Easter time, we were having them every week as we were going through the height of the COVID crisis. But as I say, we're having one in early December.
Okay, thank you. I think we have a question from David Escudier.
Hello, Lucy. It's not really a question now, because you basically preempted it in your assurance talk there. Really, it was just really picking up the fact that EOC have been never well staffed. They never have been with clinicians there. But when we're looking at the tail is starting to grow again.
Yeah.
Just how assured are you that we are making the appropriate welfare calls and we are on track to make sure that tail is as short as possible?
Well, the data I've been given, David, is that we are compliant. However, I have asked for an independent review of that data, because previously I'd been given data that showed that we weren't, and it's not about trust, it's about evidence. So I've asked that we go back and look at that. But I am assured that we now have a policy in place, which instead of having a set number, we can actually flex that number to the environment that we're in to be a bit more sensible. I think the policy we had was probably somewhat draconian in when we had to make those calls. But it will be a struggle as things get really busy. There is no doubt about that. But we are going into it, at least, in the best shape that we've been. But I can't assure you that there are not going to be tail issues, particularly when you start seeing ambulance wait times at hospitals increasing as well.
Thank you, Lucy.
Harvey?
Yeah, it's
Sorry, I muted myself there. The doorbell rang. Harvey.
Yeah, it's a question really. It didn't come up at the meeting, but looking at the last 2 days daily updates, the 999 time to answer is currently running at 90% within a second, which is brilliant, but a mean of 4 seconds. And in simple maths says that means that 10% of our people phoning into 999 are on average waiting over 30 seconds, which means some of them are waiting rather longer than that. And that's been for the last 2 days. To put that in context, that means 200 odd people are waiting about that time. And I just wondered if anything had been done about that. Is there a special reason why it's jumped up? I've seen, means of 2 and 3 before. I don't think I've seen 4, and certainly not on 2 consecutive days. So, a concern.
Yeah, in fairness to Lucy, like you're saying the last couple of days, Harvey, I know Lucy's is on top form, but I'm not sure if form's that good.
I have no idea how your working time with CCAM works out and things like that. But I think
I've got my list here of things for the extraordinary meeting, and on there I do have call answer times and wait times. So we can come back to you, but I can't answer that.
Yeah, we'll ask that will be dealt with by QPS. But just given it is an important matter you raised, the Chief Executive is here. I don't want to turn into the Chief Executive's question time, but Philip, is this something that's on your radar?
Yes, I'm not particularly worried about those levels. They're both within target. But we had 1 day where it went out to 8, and that was about staff sickness. Short notice staff sickness on the day.
Okay, but we'll ask QPS though, just to seek assurance, Harvey. Thanks for the question. Thank you. Right, anything else on quality and patient safety? Thank you. I think all of the key risks I think we are identified by QPS, and the membership of that committee is very assiduous in ensuring that they manage those key risks. Thank you. Let's move on. We're going to take the Audit and Finance Committee later on, the deep dive later on the agenda after a break. Is there anything on Michael, from an escalation point of view, you wanted to share with the committee at this point?
Just very briefly, Chair, in the interest of time, I don't want to talk about the individual internal audit reports because they got reasonable or substantial assurance. It's just the thematic issue, which I'd say is that when we had the last meeting, there were 3 obviously key initiatives underway. The implementation of 111 CAS, our response to COVID, and also preparations for EU transition. Now, all of those have got patient consequences, which are picked up by the Patient Quality Committee. But equally, we have a fiduciary responsibility as a board to be confident that we are using money cost effectively and in keeping with Treasury's managing public money. So I just wanted to give the council that assurance that the work that we did gave us the information and the evidence that we required to be confident that there was appropriate governance around each of these initiatives. So, for example, with 111, we are in a partnership, we have a subcontractor with IC24. I was confident that we had put around that good governance arrangements to ensure that the performance of IC24 was being appropriately monitored, and there was remedial actions could be taken if necessary. Similarly with COVID, good documentation of how we were using the additional money that was given to us to respond to COVID. And similarly with EU transition, we were confident that appropriate planning was being undertaken, but in recognition that we are part of a wider system and we can only do what we are in control of. So I'll explore some of those issues further, but from a assurance perspective, that accountability was operating effectively.
Thank you. Duly noted. Thank you. Can I also ask Howard, as chairman of the Finance and Investment Committee, is there anything else you wish to, anything you need to escalate at this meeting?
Not particularly.
I'm going to say the deep dive will get into the themes of your meeting.
Yeah, I mean, obviously we had those 3 meetings with the extra meeting in October to review the performance improvement plan, and as we've heard, that has now sort of effectively delivered. So that was a really good result. So from the end of October, beginning of November, as Philip mentioned earlier on, that the performance has improved, and by that time we were delivering regularly the sort of target, 100% of the target hours in that performance improvement plan, and that has continued. However, I do note, since Harvey mentioned it, that as of today, I notice on today's report that we've sort of swung from saying all measures, this is category 1 to 4, all measures have been achieved except 4, and that's now swung round to all measures missed except 4. So we'll be watching that closely on that. But we have seen, as I say, that we were very assured in terms of the delivery of that performance improvement plan. And likewise, from a financial control perspective, up to the half-year position, we are very balanced. I think there's a deficit of about 15,000, so broadly balanced overall. So we were assured from that perspective, but we are watching closely in terms of the second half.
Thank you. We do have to manage the 2 dotted lines of quality and finance, and I think we're managed to keep that balance at the moment. So hopefully colleagues can take some assurance from that. Right, any questions in terms of escalation around those matters? I see Malcolm, do I see your hand raised?
Yes, thank you. I had a couple of questions going back to the IPR, which I was directed to ask.
Yeah.
Should I ask here or following the deep dive?
Why don't we do them here? Because with the deep dive, we can talk in themes. So what's your...
So I have 2 questions. One is with regards to the vacancy rate. This is on the SAFE dashboard of the IPR, which is showing that I think over the last month or 2, our vacancy rate is in minus figures, which in itself seems very promising and positive and reassuring, which to my mind says we are at or above kind of our full establishment, which is good. However, then when you think that despite that, we are still struggling to meet our various performance targets, to me, that is very worrying. That even in this kind of almost best case scenario, obviously COVID, etc., notwithstanding, but best case scenario in terms of staffing levels, we're still struggling so much. That to me is a real point for concern, and I wonder if that has been considered as to why that is, or how could mitigate that.
Yeah, no, good spot, Malcolm, and I think there has been cause of some discussion in terms of how to getting the operating model right for the future. I just looked to the number of my non-executive colleagues that certainly briefed on this issue. I'm just looking at who might want to respond first. Terry, then Howard, you might want to comment. I can
just say what you want, Malcolm. I think Philip touched on that in his briefing, and as David said, this isn't chief exec question time, but there's been a deliberate decision made by the board to become overstaffed when compared to establishment. But if you look at the situation that we have in Medway, where ambulances are sitting outside of A&E for an unacceptably long period of time because of the difficulties that the hospital have in taking patients. We can overstaff as much as we like, but if the turnaround times aren't adequate, that will make no difference to our ability to meet the needs of the communities we serve. So CCAM, my view is that CCAM is doing all that it can to ensure that we are adequately resourced to meet the requirements of the communities we serve in the South East. But actually, the situation we have at the moment is a system pressure. And so unless we can magic up some more staff for maritime, for example, we're going to continue finding there is a difficulty in meeting some of the targets simply because we are unable to control the turnaround time of our ambulances in the way that I think we would want to. So I think that's the rationale behind it. I don't think it's necessarily anything that CCAM isn't doing, but we are part of that wider system in the South East. And as we heard from Philip, that wider system in the South East is under probably the greatest pressure it's been under for a very considerable period of time. So it's not that CCAM is necessarily failing to meet the targets. Although the targets are owned by us, those targets actually reflect system performance. And so it's the system that we need to support in improving, moving forward.
Thank you.
Can I just add
something?
Yeah, can I add something to Terry's comment, and that is that you may see from the FIC escalation reports that in addition to delivering the performance improvement plan, which was, let's face it, a short-term plan to deliver the frontline hours, which was successful, I have also requested from the executive to ensure a slightly wider strategic view, looking at our ability to be more resilient on these various different operational performance statistics. So that's going to cover looking at rostering and various policies, and that is planned for hopefully early next year. But it's a wider review about resourcing, among others, to give us some additional sort of resilience around delivery of those category 1 to 4 targets in particular.
But I think you raised a fair point, Malcolm, which all of us at board level want to ensure that we've got resilience into the future. And a lot of work was done on the demand and capacity review, for instance. But that's almost now out of time in a sense, because the world has changed around us. And that's certainly I know that's exercised the minds of the Finance Committee, and we want to get that balance right going forward. So that will be a feature of certainly the work in 2021 for sure. Philip, do you want a clarification on that before I ask a question? Harvey asks his question, then we'll wrap up for a break. Philip,
I did also ask it.
Sorry, I'll come back. I'll come back as well.
Just a very quick one on that. What the numbers, Malcolm, shows when we say it's negative, is it showing against plan rather than against our establishment. So we never planned to be at establishment this year. You can't recruit people quickly enough to do that. So it's a growing establishment that we get closer to establishment each year, and we fill the gaps with private providers, overtime, bank, and so we've got the right amount of the way we've got the right amount of hours is a totality of all of those, as opposed to being above establishment. So that's just an explanation of that.
Thank you. Harvey, then Graham. I think you're on mute, Harvey.
Yeah, right, got it. Again, if we're taking things about the IPR now, then 3 bits that I looked at, particularly on pages 38 and 39, which are the sort of the summary bits. I've already mentioned the sort of, well, we use green and perhaps shouldn't, but in terms of giving the wrong impression, on the dashboard, we don't put a colour on the number of assaults on staff, which currently is at 18. And of course, as we're probably all aware, the last 6 months has seen something like a 4-time increase or 4-fold increase in terms of assaults on staff compared to the previous 6 months. I think that should be red. I think it should always be read unless it's 0, because it's something that the Trust does take immensely seriously. I know that from all our discussions, but this document is for public consumption, and I wonder if that gives the wrong message that it's just another statistic. Similarly, we talk about the 999 abandoned calls, and there's only 45 in the quarter. That's a phenomenally small number, but it's 45 too many. And we actually quote that as 0%. It's actually 0.044%. I think we should quote the full number because it's not off our radar, it's still there. And saying it's 0 gives a wrong message. And the other thing is more in the detail. There are some stats such as absences due to mental health, which is quoted as 10.8%. I'm sure it is 10.8% of those off sick, but it doesn't say that. Somebody could read that as meaning that 10.8% of our staff are off with mental health, and that's certainly not true.
Okay. All duly noted there, Harvey. Thank you. Good spots, and we'll feed them back to what is still a new report in draft 4.
Yeah,
it's amazing, but we'll strengthen it. And they are absolutely, in terms of the assault on staff in particular. I mean, one's too many, and the board is making sure that is given appropriate attention. I know the chief executive is in regular contact with our emergency colleagues to ensure this given due attention as well, because it's a trend across the public services currently. Those in blue light services are experiencing that challenge currently.
With all 3 emergency services chiefs all met yesterday to discuss this, and to make sure that the pressure keeps on. It's not an easy one to fix, but the pressure is there.
Graham?
Thank you, Chairman. I have raised at previous meetings the situation, and I'm talking now about the items on page 167 to 171, and I have raised at previous meetings my concern about 999 operational performance only being partially assured, and we keep reading terms like, in terms of assurance, the committee is confident the executive is giving the right level of focus, but there's much work to do to improve our performance against the ARP standards. A little bit more jargon. And then that was a meeting in September. And then when we go to the meeting in October and November, we see basically the same terms, but whilst performance might have improved against our peers, it appears not to be good enough. Now, apart from a safe for category 4, where it's obviously not improved at all. And Chairman, our role here is to hold the non-executive directors to account, so to speak. And what are they doing to challenge the executive directors? My question has to be, I think, if the National Health Service doesn't really mind about the fact that we're not meeting these targets, well, okay, let's be open and honest and say that, and then I can not bother Howard anymore, and we can say that this is fine. But on the assumption that is not the case, I have to, I think, put the point, how long are we going to keep having paragraphs which says that you are sure the management is doing what it reasonably can to maintain performance, but you do say that you are only partially assured, and therefore I feel very uncomfortable with that. If you have been only partially assured now for a very long time. But my question is, what is going to be the long-term solution to this? Because it is not just a question of saying, well, you're happy that they're doing their best, and I'm sure they are. And I would never doubt that Philip and his team aren't doing their very best. So no, of course, but I mean, my question is, what is the long-term solution going to be? And I was also going to, well, I've just got the floor, Chairman, if I could mention also the PMO. I can never remember whether the P stands for Programme or Performance, which is another reason which I got very confused in the middle of the night. But there are structural issues. This sort of came out again in the board in the papers on the 12th of October, 12th of November, and again I was uncomfortable that again we've only got partial assurance, and I was going to just wonder whether Howard could comment on what he thought the forward thing would be looking to the future, and finally before I stop. The fleet strategy delivery plan, which does seem to be an important issue for CCAM, and again, the committee were clearly only partially assured, and I think that's a worrying position. And what do you think can be done to challenge the executive team more strongly about the fleet delivery, about the fleet strategy delivery plans? And I do think that is an important point. And I would also ask, please, Chairman, could someone please tell me what PAP stands for, which is halfway down page 172?
That's private ambulance provider. That's our
thank you very much. Do you know, I spent a long time in the middle of the night trying to work that one out, and I never came anywhere near that.
Yeah, absolutely.
Thank you very much.
And anyway,
Chairman, that's it from me. I just appreciate
and
some comments from Howard. I say, if you tell me to be quiet about operational performance, then it's all fine. Well, that's another issue. But you know, I would never bother Howard again. But I think there is a serious issue here that we keep on repeating the same thing.
I'm sure Howard lies awake at night as well and thinks about our performance, I can promise you. So Howard, then Michael, and then others may wish to comment on the fleet strategy. But Howard, first of all, then Michael.
Yeah, the first thing to say is I absolutely and wholly agree with you with your observation. And so the reason I was dealing with your first point, of course, is the partial assurance and the performance is all about the short-term nature of the performance improvement plan. And so the reason it's not full assurance is all to do with the point that I mentioned about the longer-term strategic review of resourcing, policies, rostering, meal breaks, etc., which is going to give us a more sort of holistic view about our ability to deliver against the category 1 to 4 performance in particular, you know, in a more secure way. And so whilst we have over the last few meetings been sort of firefighting with our performance improvement plan against all odds and delivering those frontline hours, what is clear is even when we deliver, as we have been recently, 100% of those frontline hours, we're still not there in terms of regular performance against those categories, albeit that we have substantially improved and against the competitors. So the answer to your question specifically is the reason why it's partial assurance is because I do not have that visibility and assurance and of the strategy around the resilient business model to deliver those category 1 to 4 on an ongoing basis. That's why I've asked for the executive to deliver that, and I've done that repeatedly, and I'm assured that they will do that either in Q4 or beginning of next year. But I have requested that repeatedly, and I think a number of others have as well. So until we get that, as it says in there, you know, we're still going to be struggling, I think, about meeting these. That's not to say, as I say, we have to recognise that there has been some jolly good performance improvement, but we need to move to the next level that gives us that regular ability to improve, you know, within the financial constraints that we operate. If it turns out that we do not have the finances to be able to deliver that, then that's a separate discussion.
I agree.
Secondly, your second point on the PMO. So PMO stands for Programme Management Office. And the only reason why that was partial assurance was very simply that we were very assured around the Programme Management Office itself. The only reason for partial assurance because we were not assured that every single project was captured by the PMO, and we sought to question how they are going to ensure that projects do not commence that are not part of the Programme Management Office. Provided we get that, then I think we can be absolutely assured that the Programme Management Office will be fine. Finally, your third point on the fleet strategy delivery. So we've seen at FIC 2 papers previously, we had I can't remember the one before September, so it would have been July, August. We had the proposals to invest in the fleet and have proceeded with that, approved that, and that went to board for approval. So we should be seeing some improvements in terms of the age profile of the fleet. And the reason I think why that this paper that we saw in November, just earlier this month, on the fleet strategy delivery plan, is it didn't quite give us what we want in terms of comfort around the improvements to deliver the lower, what we call the vehicle relief rate, i.e. the excess number of vehicles that are required to deliver against our peak load. Now, one of the reasons behind that is that there has been relatively recently a new fleet management system, which will eventually give us the data and information that we need to or provide us with the fleet usage statistics. But we don't get that information immediately, and we need basically a best part of a year to understand what that is telling us in terms of usage, that will then hopefully allow us to analyze how we can improve the vehicle relief rate. But we are expecting to see, with a combination of the reduced age profile of the vehicles and the investment in the MRCs, that's the make ready centres, including Brighton and Banstead and Medway, we are expecting to see an improvement in that overall fleet management capability and reducing the number of vehicles that we have or need to meet our peak demand.
Thank you very much. Thank you.
Thank you, Howard. Michael, did you want to add any comments before there's a question from Malcolm? You're on mute, Michael.
Just to reiterate, and I know we're going to have a break, I really support what Howard is saying, and I'm going to say a little bit more about that when I get to the audit committee deep dive and around governance. I genuinely agree with all that you're saying, Graham. We had a demand and capacity review, which is now, I think, nearly 3 years old. There are a number of assumptions in that demand and capacity review that we don't know if they remain relevant. And until we actually get to the bottom of that and we have a realistic assessment of what our staffing levels are and how we deploy them in the best way, I don't think we will ever get to a long-term solution. So it's long-term solution that we need to be looking for, and it's around resilience. And I would share, Howard, and your concern that if you look at our performance against all of the other ambulance services, we are still not really, yes, we've made some improvements, but my question is about how sustainable are they? You know, we can't keep improving and then falling back. We want to get on a trajectory is about long-term improvement, and we're not there yet. And I would share your view. We have asked as a board that we really want in the next quarter before we start the next financial year, a workforce plan that is based on evidence about what level of staffing the organisation needs and whether, therefore, over what timeline we get to that establishment, and that is key. So while we get partial assurance, we are putting considerable pressure on our executive colleagues that we need to deliver on this in the next quarter.
Thank you.
Thank you. Just need to keep an eye on the time. So I'll take one more question, Malcolm.
Yes, I'm afraid I've got 2 more questions. I can only apologise. Right. Again, going back to the IPR on the well-led dashboard, it indicates with regards to late finishes that there is a 50% late finish rate, so 50% chance of having a late finish on any given shift, and that the length of these late finishes are on average 40 minutes, which to my mind, both the percentage and the time is far too high in my opinion, and will certainly be having an impact on the quality of life and morale, fatigue of the crews, but also the ability of to turn the trucks around and get them cleaned and restocked for the next shift and so on and so forth. So really, I'm just wanting some assurance that this is on your radar, executives and non-executive colleagues, and that this is an area of focus and that is being looked at, please.
Yeah, yes. Can I just say it is focused both from a staff welfare point of view. That's our major consideration in these things, Malcolm, because quite frankly, that's not going to help in terms of the staff welfare if they're finished late, and then that means they're going to be late for their shift the next day, because we give them compensating time off, I understand, as well, so they're starting late the next day. So it just compounds the efficiency issues as well. So it is very much part of our overall approach to this. It's not just about efficiency; it's about staff welfare. And that gets the eye line of both all my executive, non-executive colleagues, but particularly in the key committees. Yeah, so we are very well aware of that.
And I think that leads on to my second question, which is it's a bit broader, and throughout various points in the papers for this meeting and discussions as well, there have been comments about increasing hours from the current establishment of staff, performance improvement, efficiency savings, improved productivity, items in the performance improvement plan from the board meeting, about all of these things and so on and so forth. And again, it's a bit of a broader comment that actually what these kind of what these terms actually result in the real life is an increase in workload and stress pressures and really micromanagement, if I'm being honest, of the frontline crews, and that really the feeling from my colleagues is that they're sort of being pushed right to the edge of what's possible at the minute. So I'm not sure if there's a specific answer that any one of you can give me on this, but more again, I'm wanting some assurance that these issues are considered when talking about, oh, let's increase productivity, the real life impact that has on crews, and perhaps if in the future wording language could reflect that is being, and I appreciate you're telling me verbally that is high on your priority, but that isn't reflected in the wording in any of these reports. It is all about the numbers and the hours and the productivity, and doesn't seem to reflect the real life impact this has on my colleagues.
Yeah, no, I think if I can just answer for the board, I think I take that point, Malcolm, in terms of the way these are expressed. But there's 2 challenges here. One of which, as a board, we've got to ensure that we're demonstrating maximum value for the taxpayer in terms of delivering a service. And you're well more aware than I am. The consequences of not delivering a service means that we're going to harm somebody, either harm a member of the public or ultimately cause some serious harm. So all the time we're trying to strike that balance between demand and supply, really, in terms of what we can do. So we've got to, there'll always be that pressure to perform in any public service. But I think if you look at our expenditure, for instance, on our wellbeing services in the trust, and the time the QPS committee in particular spends on assuring the safety of our staff, as does the Workforce and Wellbeing Committee, assuring the safety of our staff and patients, to get that balance right, I think we do that. But I do take your point about some of the language occasionally. But we have to also demonstrate that we're providing that value. So Terry, you want to add to that?
Just a very brief point, really, just to reassure Malcolm that both at WWC and at board, I recall we've discussed the specific example of overtime. that one of the issues around offering overtime, of course, it allows us to be more efficient, but it also means that staff have the option of undertaking significantly more hours than actually might be appropriate. So there's always that issue around overtime, as I say, although it helps the organisation meet those additional hours that we need. Both WWC and the board at different times in the last 12 months have discussed the additional pressures that offering overtime places on the workforce. You can, as a throwaway line, you can say, well, nobody has to do it. But that's not the issue, is it? If you offer overtime, people will always, there will be people who will always feel they need to do it. So we have specifically discussed the issues around making up additional hours through overtime. And it's been a very conscious discussion around wellbeing of staff.
Thank you. Waz, do you want to ask a question on this particular issue?
It was around the integrated performance report. I thought this would be the right place for it, but
yeah,
I'm happy to leave it. I know we're overrunning. On the national benchmarking, we are below national average on hear and treat rates and above average on see and convey. Now, that obviously means we're sending more ambulances than our colleagues around the country to instance, and we're taking more patients to hospital, which means there's a longer cycle time, which in the current climate means that we're actually spending longer on incidents. Now, both of these, we're on the wrong side of average. If we can improve on those, we can improve performance and staff welfare and patient outcomes. So is this on our non-executives' radar, and how are we assured that it's dealt with effectively?
Yeah, Lucy, I know this came up at QPS last week, I think, if I remember correctly. Just you're on mute there, Lucy.
It certainly was. It's certainly on our radar at the moment. It's a issue we're going to face throughout this period, I think. And I think it's a good one to actually add to make sure we talk about in the extraordinary QPS as well.
Thanks for that prompt, Wes. I think, Philip, if you want to clarify a point, then we'll take a break.
Yeah, so just in answer to that, we've been pressed on that for a while. There is a formal, the thing that I noted when I got here was hear and treat particularly. And at that time, the answer was we're short of clinicians. Now we're not short of clinicians. At QPS we were discussing, we've solved that problem. Now why aren't we getting much more hear and treat? We're about 1 to 1.5% behind the national average. So we started a specific hear and treat improvement plan, which has been going for some months now, and it's only made a very small increase. So we're reviewing that, and we'll drive that harder. But Waz is exactly right. Anything that so hear and treat needs to be higher, see and convey needs to be lower, and that will mean that we're all working more efficiently.
Right, and to sum up, sorry, Lucy.
Sorry, and it did specifically come up, if you look at the board minutes, which you probably don't want to do, Waz, but if you look at the board minutes last week, it did specifically come up at board, that point, and has been put on that agenda. But it's interesting because there were two trusts that were quite low. They were in the sort of 4% from memory, and there are other trusts that are at the 8 and 9, and we seem to be the sort of in the middle, around 6ish, but this outlier. And so, and as we have the clinicians, it is a question as why. So it's a good question.
Yeah. Okay. So I think the general theme for that last item, though, is I think the word resilience was used. How do we get our services more in balance to make sure that we not only deliver a service to our patients, but also do so with a well-balanced staff resource and don't push our staff to breaking points. So we've got to make sure we strike that balance, and that's the point that I think Howard is really making in terms of what we're asking for as non-executives in terms of our future plans going forward, is to make sure we have both that workforce and equipment resilience to make sure we can deliver an efficient service, as well as a quality service. So can we conclude there? Can I suggest we take a 5-minute break and conclude and come back just after 12:20? We've got some time back. There's our colleagues from KPMG aren't joining us because of illness. So we're not taking the annual report of the report from KPMG. So we'll go straight into the scrutiny items straight after the break at 12:21 or thereabouts. Okay.